patient units. The problem with that's going to be we're locating the HVAC systems, electrical closets, IT closets on the roof of those areas. So we'd have to take those off, build, and then put them back on the roof. So I think we're kind of at the maximum capacity of that building on that site at 104. It's a good question.
Well, the reason I pose that is, and I think one of the agenda items was catchment area.
Mhm.
And somewhere you or the legislature or several people, or we're going to get into a conversation. What do we do with Larned? Or we can avoid it completely, but that's been the discussion for the last 30 or 40 years is how do we deal with Larned population it has,
right,
and not being able to staff it. So you or somebody's going to have to deal with that decision.
There may be a third choice besides me or somebody, but I'm not quite sure who that is.
Speaking as someone that's been involved in them, it's good.
It's been a long conversation. Okay, thanks, Tanya, for your update. I just had a couple of other things related to the project. Tanya mentioned the design. We are reviewing the document set. It's a lot of information to go through, but it's the product of also we added it all up 40 plus hours of meetings with the design team to go through that. So we're just trying to double check that everything got into those documents. We were supposed to have them all reviewed by Monday. We've had some people out. Our consulting architects are out as well. So we're going to take a few more days to make sure we've done a thorough review. But we think that's time well spent now, as opposed to when we get the construction documents done and then miss something or something else that we didn't review or make a change later in the project. We're also working. One of the questions that we had early on was about how to certify this building for Medicare and Medicaid billing, potentially having it accredited by the Joint Commission as hospitals and other facilities can do. And we were trying to figure out who can give us advice on looking at the design, looking at the construction process to move forward in that process. We reached out to the Joint Commission to ask them some questions, and they pointed us to a consulting arm that they have called Joint Commission Resources, whose job is to consult with people building facilities and running hospitals and institutions on the accreditation process. So we've had a couple of conversations with them now about bringing them into the project as well to evaluate it. They provide a service of starting at design or starting when you're just thinking about building a building and walking you all the way through the construction process. We're going to bring them in a little later than that, but given where we are, but we think that's a good idea to have, again, outside folks. The Larned teams, the Osawatomie teams have been really helpful, but they're also, they live their experience. So we want to have some outside consultant help to make sure we're designing something that will work and meet all the modern requirements for that. So a couple of updates around that. In terms of a couple of state government things that are relevant to the project. So one thing that I'm working on in the next week, we have to submit a capital improvement budget as a as an agency. That happens at the end of June. This building hasn't been part of our capital improvement plan as an agency for reasons that are not terribly important. But for this submission, we are including this hospital construction project as a capital project. Primarily what that triggers is more additional review by the state Joint Committee on State Building Construction, which is good. They look at buildings all the time. They'd be overseeing it anyway, but we'll reflect that in the capital budget, and that happens in the next couple of weeks. And then when we submit our agency budget in the fall, that happens on September 15th. So we're in that beginning process now. We'll have to account for because it covers the current fiscal year that starts on July 1st and the next fiscal year that starts a year later and runs through 2026. None of the operations of this building, but some of our expenditures related to getting the operation started will be in that budget window. So we're going to have to submit something in the budget for this hospital. I'll keep you apprised of that. We don't have it quite all figured out yet, but we will before that's due on September the 15th. And then the last thing that I had, just as another update, and I think it's relevant to the project, in the budget that the legislature approved and the governor signed, KDADS was given the authority to do something that no other agency can do. We can award bonuses to our state hospital employees. Right now in state statute, there's a cap of you can only give a state employee a bonus of $3,500 a year, and it can only be for exceptional service. So they have to do something above and beyond the ordinary. We were asked in a couple of our appropriations committees and a special committee that met about workforce and our contract staffing, what other authority would we like to have? And we proposed doing some other kind of bonuses for state hospital employees, things like a sign-on bonus. So if you're a new employee and you apply, we can give you an award of $1,000 based on being a new employee, and if you stay for 6 months. Referral bonuses for existing employees that bring somebody else to the hospital. Some retention bonus ideas. And then one that we're really excited about is a pickup shift bonus. When a staff member picks up an additional shift, that's a hard to fill one. So a night or weekend shift, we could pay them $150 for working that shift. So the legislature gave us kind of general authority to do other things. That's what we've proposed to try to build out for the beginning of this fiscal year. And they let us raise the cap for that bonus to $10,000 per year per employee. So we're hoping to test is if we can do some of those things around incentive that maybe are more private sector-y kind of incentives for employees. That'll help us with recruiting, help us with retention, which is a good thing to prove in our current model. To Representative Helgerson's point, it should help us at Larned and Osawatomie to fill vacant positions with state employees as opposed to using contractors. Just to be said, I think this will be a good test for kinds of things that we need to be a competitive employer on our current campuses, but it'll apply to this campus as well, building as well here in Wichita as we build that out. So as we get a little, we've been working with the personnel folks to figure out the payment codes and the tax implications and how to actually implement it. But we're optimistic that we'll be able to start paying some of these things out in the next before the end of July. So probably when we meet later in the fall, give you an update on what we paid out, what impact we've seen on recruiting, retention, new hires, those kinds of things, just to let you know what our progress is. But we're very excited about it. We didn't really need one more thing to do, but this is something we've asked for. So it's taken a lot of additional effort, but there's a lot of excitement on campuses to get that rolling as well. I think those are my couple of updates about the project. Any questions for me? Okay. Moving on to the next agenda item. So one topic we've talked about before, and we've had some presentations, I think it was in the March meeting, from some national experts about privatization. It's one of our charges as a panel to give advice to the governor and the legislature about as we think about operating this facility. Do we want to run it as it'll be a state hospital, but do we want to run it entirely with state employees? Do we want to contract out certain parts of it, or contract the whole operation out to a private vendor? What we're proposing as an agency is doing a request for information. So it's like a bidding process, only the end result is not a contract. It's a document or presentation or some kind of information that's given back to us by vendors that want to respond to the questions. So what we put together, or my team put together, is this document to kind of give you a little bit of background, really summarizing things we've talked about before. And then what we'd like to get some guidance from you today on other questions that we'd want to ask in this request for information. It's not a one-time only. I mean, we can certainly, I think our hope would be that we would get some number, more than one vendor that would be interested in responding to the request for information, inviting them to a future panel meeting to either present or be available for questions. We can certainly gather more information that way. But the core of it's going to be what they write in their proposal. So that's where we need to flesh out the questions, have some ideas of information that we'd want to ask for, and then put that in the form of reasonable questions that vendors could respond to. So we did put this document together to kind of guide the discussion a little bit, or again, I think it summarizes information that we've already talked about. So there's a few points, and then that'll get to the questions. First, we wanted to, and I don't think we did it in the March meeting, but just to say we do have privatization on state hospital campuses today. It is limited to certain services. So we contract out for our food service. We've talked about contract nursing, or so agency staff. We've talked about that before. Some of our laboratory services are provided off campus by private vendors. Dental services, other kind of medical services that aren't part of our core operations, we contract out for. So we're not, so we're accustomed to having some private operations on the campus. Second, there is a limit in state statute on privatizing services at state hospitals. And so we provided what the statutory reference is in KSA 753373, which is focused or limited to Larned and Osawatomie, saying that we can't, without asking the legislature, we can't contract out any operations or facilities at either Larned or Osawatomie without a specific authorization from the legislature. So it doesn't say anything about a Wichita hospital or another state hospital. It's limited to the two that we operate today. But I think it's a fair fair assumption to make that if we were going to suggest or recommend privatizing the operations of this Wichita hospital, we'd probably want to let the legislature know about it and probably seek some authority to do that. So that's more for your information, and maybe a recommendation that the panel would want to make as we get closer to the final report, to say we want to amend that statute or add the Wichita building to the statute, whatever the panel would want to do. But I think we have to address the statutory question at some point. Then third in the document, we just summarized primarily from the minutes, but going back through the presentations that we got from the National Association of State Mental Health Program Directors teams about kind of things to think about. So you can read through that, or you can watch the video again of their presentations. But I do think they had some good suggestions about what other states have done. I think as we get closer to an RFI, or as we we probably talk to some other states about what vendors should we send this out to request information, since some other states have that experience. And that gets to the last page and a half or so of the document. So what we would suggest in the RFI is that we would seek proposals from companies that have experience doing this kind of work, and allow vendors to respond across a couple of different options. One would be, what if we turn the keys over, but what if we let a private vendor operate the whole hospital en masse? That's one option. Another option would be to privatize only the like non-clinical services. So run the maintenance department, the environmental services, food service, or some parts of those things. So we could seek vendors who have experience in that. seek vendors and ask for information about privatizing the clinical operations. So the medical team, the psychiatry team, nursing lab, those kinds of things. So the whole thing, the support services side, clinical side, or then maybe it's splitting it as we've designed the building where there's a forensic treatment side and a care and treatment side. Maybe a vendor would want to operate one of those programs, but not the other, or both. So those are kind of we think that opens up a number of different vendors that would be and could be interested. Lets small companies, opens the possibility to them as a vendor. Large companies, it probably doesn't matter. So it does, I think, give a wide range of options for different kinds of proposals for us to look at and think about. Then we listed a variety of things that we would want the respondents to write about or give us information about. A cost analysis. Probably need to narrow this question a little bit to what some kind of common unit of measurement that we can use to compare one proposal to another. So what would it cost per bed in your proposal to operate? Something along those lines, but you have to get some idea of cost. Want to make sure they understand the workforce questions that are here and then give us some thoughts about that in the Sedgwick County, South Central Kansas area, how they would approach recruiting and retaining staff, including providing training opportunities in the building, because we've talked about that's what we want part of the mission of this building to be. So we want to know their experience doing those kinds of things. Operating healthcare facilities or secure healthcare facilities, working as a contractor with the state for acute psychiatric inpatient facilities, because that is a specialized activity, doing competency related work or forensic work. What they'd suggest as a proposed contract term and performance requirements. Jason asked a really good question after he got this and looked at it. We didn't put a lot of information about the performance requirements that would be in a contract, but we do. We've got a lot of experience at the state level in managing contracts. Some really positive, some not so positive experience either way. But we would want to have those elements in the contract as well. Anything about technology that they might have as innovative approaches to either make service delivery better inside the building or reduce the amount of staff that would be needed. And then we put a few things of kind of programmatic ideas that we've got operating on the state on in-state hospitals, trauma-informed care, using peer supports, person-directed planning, some of the kind of, again, we want this to be part of our system. So those are all themes that we try to implement on our other campuses. Then there's it's a slightly shorter list, but another list of kind of not boxes to check, but kind of basic information we want to get from all the companies, whether they're accredited, how they meet as a private operator, meet kind of the daily needs, transportation, providing hygiene materials, those kinds of things. Their experience working with other states. So we wanted to tell us about other states where they have contracts and what their approach has been. Their experience in the industry, working with community providers. We think that's important, again, given the charge that we have to make sure this is well integrated into existing systems. How they would approach the clinical model, because there are some variations in how that could work. How they propose coordinating with admissions and discharges, compliance types of activities around risk management, quality management, those kinds of things. And then it's always one thing I've learned in the last 18 years or so of being a state employee and managing fairly large contracts like this. You always ask whether they've been disbarred, asked not to work in another state, they have a history of fines or penalties from other states. That's an important thing to ask, and then see how they respond. We give them some additional information around this panel and some other reports from the legislature, information that you've all seen, and then ask them to respond. Put it out, give them 30 days or so to respond. Some opportunity in there to ask us questions about the RFI and make sure their responses are well tuned to what we're asking. And then once we get those proposals or those responses, share them all with you. Again, invite them to come in for presentations. to this panel or other, maybe probably not a town hall. This is probably the right group, but so that would get us somewhere into the fall, talking to vendors and again, in a way that doesn't advantage anybody, doesn't disadvantage anybody. When we put out a real RFP, everybody'd still be able to respond to that, whether they participate in this process or not. So what we're looking for today is any suggestions about other questions to ask, other refinements of what's in here. Again, I don't think this is a comprehensive list. So suggestions you might have about information that you'd be seeking. Representative Carpenter, sorry I made you wait with your hand up, but go ahead.
That's fine. So two things on that. What's your timeline for those questions?
I think what we've talked about is putting this RFI out in August, with responses back maybe by the end of September. So we'd have some time to vet it before we got into, before the legislative session would start. That would be my
So
hope.
2 or 3 weeks.
2 or 3 weeks from
3
now would
weeks.
be, yeah.
Okay.
We could probably
the
bring this
second-
back up again at the July meeting as well, just to have another formal opportunity, or maybe review the draft of the RFI. That might be the next logical step.
That's probably a good idea. So when we've had conversations about this contracting, you've said in the past that there were certain folks that had to be state employees. What are those?
So and this is just me talking, but I think it's really important that we control the admissions and discharge process. So who's admitted and when people leave and how that's coordinated. So I think at a minimum, there would be some kind of a superintendent or a site director, and probably some kind of a director of admissions that would guide that process.
And that'll be in your RFI then?
Yes.
To the companies that you'll have to put that in
Yes.
for those companies.
Right, because we'll have to define where the limits of the potential contract would be.
Right.
And I think the only kind of non-starters for me are there may be others, but the one I am most confident about, and will advocate for the most strongly, is admissions. Because I think we need to be able to determine who's admitted and who's not.
Fair enough. Okay.
I think there's a reasonable case to make to have a medical director that's a state employee, a chief psychiatrist. I mean, I think there are other things, but admissions, as I think about it in our system, I don't want to have one hospital in the system that we run that can pick and choose who's admitted and who's not. Sorry.
Fair enough.
Good questions. Are there other thoughts?
You answered this, Scott, but the goal here would be to put the wide casted net RFI out to see what interest there was. And that would be followed up then with an RFP more definitive, where we'd actually, if this is the direction that the RFI points us to, then an RFP goes out for actual competitiveness in bidding for whatever the RFI, that's your
Yes.
thought process.
Yes.
So in the RFI, I think this is very exhaustive. I mean, I think this is a really good document, because sometimes in an RFI process, the vendor will bring in something we didn't think of, and you almost kind of expect that.
Right.
So I think this is really good. And then you can always, if the goal is then to RFP it for a more definitive bid, then you can add other components to it, which are more dialed in. So this makes a lot of sense. We cast a wide net out. We're pretty general. We see what we get. And then help me understand, who does the legislature then decide if this is the tack forward? Who decides if we go to the next level RFP?
So we as a panel, it's in our charge to make a recommendation to the governor about this as a direction. So I think the governor would want to will want to weigh in on, well, there's kind of a no go. I mean, if she's interested in any kind of privatized options or some things, but not others, that's her decision. I think the legislature's interested in the question as well. I think the timing part that's a little hard for me to figure out is when this kind of contract would start, because would want a vendor if we were making a decision about privatizing the whole operations of the hospital. We want that vendor to be on board as the building is ready to occupy, right? So that's not the budget cycle that we're working in now. It's more in the next one. So I think we maybe got two bites at the apple. One is this budget submission in the fall. And so making a recommendation to the governor before December would be helpful about kind of direction. We can talk about it with the legislature when they come back in January as well, and see if they have some other direction that may be the same or different. And that lets us write an RFP this time next year and then see where we go from there with that direction. That answer your question?
It does. I think it makes perfect sense to go out with this RFI, just to explore, not committing necessarily to anything. And then refresh my memory on when do we think this is going to be open and operational? Just what year was that going to be? When, what's our?
Yeah. January 2027.
Okay, so there has to be some sync. It has to be staffed.
Right.
By January 27, whether it's private or state employees. So we need to.
It's not a lot of time.
Yeah, I mean, we got to keep moving.
It's short.
Yeah.
I would just like some guidance on the direction. So at least some companies have reached out to me interested in the project, wanting to know more, asking how they can become involved in sharing information. And given the concerns about competitiveness and the ARPA funding and other things that we've talked about, said, well, that's good. Don't reach out to any of the panel members. We'll figure that out. So I think this is a way to get information into the process in a fair way that doesn't disadvantage anybody or advantage anybody in that process. But I don't want to impose all of it on you all as a panel. But I do think there's a need for some information to come to you to have discussions or at least ask questions. So I guess the worst case is we put this thing out, we get 40 responses, and we have to figure out how to, I don't think we're going to have 40 people come in here and give presentations. We want to narrow that down some, but just mostly wanted to take the temperature of the group. If we're in the right direction and you're okay getting some vendor communication through this kind of process, if that doesn't seem overwhelming.
Well, I would agree, Scott. I think if we are looking at making a recommendation, it would be good for us to have more information and some mechanism for whittling that down to a manageable workload for the advisory committee. I would be interested in that.
Other thoughts about? Okay. So if you've got edits or suggestions to the document, feel free to send those to me, and we'll I don't know if Melinda and Rita are on the call or not, or watching, but this will be something we'll add to our list to keep working on, either to present the full RFI document to the panel in, but it'll be July. We'll try. We've got a pretty good start on it, and there's a request for information is much simpler to write than a request for proposals. You don't have to put all the legal language into it. So I think we can get that done by July, but that's the direction that we'll move. Okay, thank you for that. I put on the agenda my attendance list. A discussion about the catchment area. We talked about this last month. And gave you some admissions data for Larned and Osawatomie over the last year or so. But I did want to, and the subpanels have made a recommendation, but I just wanted to have another opportunity to talk about it with another month of experience and thinking about it, if there are other thoughts about catchment area that we could capture. I did put don't mean to put Joan on the agenda because I don't think we heard from ComCare in that discussion about catchment area. So we'll let her get settled a little bit. Timing is. I wish I can't even get the Zoom to work or get the links right for that, but give her a minute to get oriented to catchment area.
Oh, I'm so sorry. I had it on my calendar for 2.
Oh, you're okay. You're okay. But anyway, any other thoughts about catchment area or information that you all need to help guide that recommendation? Where I think we left it last month was the subpanel had said Sedgwick County and the surrounding. And then the district attorney made a really good point about maybe we don't want to define it right away. Maybe we want to get some experience and then define it, which makes a lot of sense to me too. But we also wanted to hear from our mental health friends and I have talked to the executive committee of the association a couple of times.
Oh, good. What did they say?
Well,
I thought I brought a map of the community mental health centers
that'd be
because
great.
of our gatekeeping role.
Yeah.
For the state hospitals. So we've talked about this before, but the mental health centers are responsible for gatekeeping for eligibility for the state hospital admissions. Oh, I gave you more than that. I gave you more papers from my packet. Sorry, that was my miscellaneous stuff from the back of my packet. And so, I mean, to me, this is called the South Central Mental Health State Hospital. So it seems like it should be a regional approach versus just a countywide approach. That's my take. In terms of numbers, I pulled your documents that you had shared with us in the past, and none of the counties are large contributors to the mental health centers other than the large counties like Sedgwick. So I think we can include several of those easily within that area of our scope of coverage. Right now it's a regional approach to the crisis centers. So that would be Sumner, Kelly, and Butler County is the catchment area for the crisis center. Just as a starting point for conversation, but Horizons is sitting out there as well, very close in proximity. And catchment area. So those were the thoughts I had, is just looking at this. It seems like it should be definitely a regional approach.
Any counties you would, so Reno, when you look at the data, Reno's kind of one county that has a pretty sizable number of admissions that go to Larned now.
That go to Larned
Any
now.
thoughts about?
It seems like Larned should stay with Larned. They don't have the same capacity issues that Osawatomie State Hospital is. They weren't on a moratorium for a decade like we were. So it seems like it should be the eastern side of the state in that area. I'm surprised the executive committee doesn't have a recommendation.
Their general comment. Well, the one Greg Hennon from Fort County, I think his thought was he wouldn't want to drive past this building to get somebody to Larned, and there's a scenario where that could happen. So I think we need to think about that, but I'm not sure what.
And Fort County incorporates Kelly now, because they absorbed that one when they merged.
So there could be maybe that was more of an operational question. I want to make sure I got it right in the minutes, Joan. So the crisis center that's in Sedgwick County is also
is
open
a
to
region-
Sumner, Cowley, and Butler
Is a regional
counties.
model, yeah.
The other thoughts that you've had about catchment area or other information that you want to see? I haven't pulled any more admissions information since the last batch that you saw. Okay.
Scott, this is Claudio. I agree with the contiguous counties of Sedgwick with that recommendation. I think that makes a lot of sense. When you look at Larned and Osawatomie, given where they're located geographically, their catchment areas are probably bigger given the population density in terms of overall reach. I mean, for us, even at Ascension Via Christi, and we're treating people from all over the state and even out of state for that matter. So I think it matches with the population density and ought to be a regional facility, as Joan had articulated. And I think it fits well with the overall mental health community health centers that are in place. So I support that recommendation.
Thanks.
The one thing that I have experience with is the labor shed. And really, when you think about Wichita, it's an hour's drive in almost any direction. And it's the 9-county region that touch Sedgwick. So it includes McPherson and Harper County or but
I know it's tiny.
yeah, it's the 7 contiguous plus the 2 north of there that we view as our labor shed. Because once you get beyond an hour's drive, then you really don't see Wichita being impacted.
Okay. Again, I don't know that we need well, we can think about that as a recommendation in the final report if we are settled on something, or start with, Sedgwick County for sure and see what other counties report back and recommend that the legislature or governor look at it again a year after we're open and operating. Again, I'm trying to think ahead for the next legislative session, what we need to get changed in statute to create this hospital. Don't know the catchment area is one of those, but we need to figure out how to fit it into the law that says state hospitals have catchment areas. Okay, the last business item on the agenda is preliminary recommendations. Representative Hobson at the last meeting mentioned kind of having a standing agenda item that if folks had recommendations they wanted to start thinking about putting on the list for us to write up in a more formal way, given that we've got till September, the end of September, we've got to keep that on the agenda. So it's on the agenda if anybody has a recommendation concept they want to introduce or something more formal than that. Or have an open agenda item. Yep, Claudio.
Just going back to the catchment area just for 1 second, when we think about the proximity of Sedgwick County to Oklahoma, does that even come into play would an out-of-state patient ever would enter this facility or not?
Yes.
I mean, we've had them before.
Okay, that's what I thought. I just wanted to verify that.
Our process today is the mental health center still screens everybody. But if the mental health center is interacting with somebody who's driving on I-35 from Oklahoma and they stop in Kansas or have fall into crisis while they're in Kansas, it's the mental health center that they interact with that screens them for a state hospital admission, and then we evaluate them based on their clinical criteria, legal status a little bit, but not based on where they live. That really, no, Arnold gets out-of-state admissions too. I was gonna say that it's mostly an Osawatomie thing, but it's not. Other recommendations? I'll also put on the agenda going forward, sort of the charge again. There's 3 or 4 items: catchment area, privatization, operations, working with the community, and workforce type issues that are in our charge. Just, you know, we can make recommendations about anything, but those are the ones that we've been asked to respond to. But we'll keep that on the agenda going forward. Any other items to come before the group today? Just a little telegraphing for July. So I think we're going to have a discussion about the Center of Excellence, the kind of workforce center that's in August. Oh, okay. I'll have to figure. Oh, that's right. I'm sorry. I'm not quite sure what we'll be doing in July, but we'll do something. Well, we'll have more of the design done by then too, I suppose. So we should be able to show you more of that. Oh, and we are working on another town hall session closer to the site at MacArthur and Meridian sometime in
First or second week of August.
first or second week of August. I think do we have a location?
We are narrowed down to Campus
Yeah,
High School
right.
or the Machinists Union. Variety.
And the goal for that one would be to show the, not just the video, that would be a little challenging, but show some exterior renderings of the building, the floor plan, some color, well, exterior rendering. So folks from the neighborhood can see what the building is going to look like and try to fit it into the site. Then we'd also invite the folks from One Rise to talk about the development of the rest of the property, just what other thoughts they might have about that. Just again, introducing the neighbors to, well, hopefully it's not an introduction, talking to the neighbors about what we're building and developing on that site. Okay. Anything else for today? Sorry for the technical hitch. It's been a while since we've had one of those, so we're probably due, but we'll keep working on it. If there isn't anything else, our motion to adjourn. Motion and second to adjourn. Any objections? Hearing none, we're done for today. Thank you, everyone. Have a good weekend.
Thank you, Scott. Have a good weekend.